PrEP-related stigma. So welcome everybody to the West Africa PrEP Learning Network series, and this session particularly is going to cover PrEP-related stigma. Next slide, Allison. So just a note about interpretation. I think for those of you who are returning, you'll remember that we've done we've been having real-time translation and interpretation of the presentations and of the webinar. And so to access the interpretation, and actually even for those who are joining and want to listen in English, please go to the interpretation button at the bottom of your screen, that globe, and select either English or French, and that is the language that you will be listening to the session in. So if everyone could go ahead and do that, please choose either English or French. And then if you are listening in French, I'd recommend that you select mute original audio, and that will make sure that the French interpretation is very clear and you don't hear kind of a soft English voice in the background. So please go ahead and make that selection. Welcome to those of you who are just joining. We're just talking about the interpretation feature now. Go ahead to the next slide, please. So this is just about the interpretation feature. We're using Zoom's simultaneous interpretation feature to make sure that everyone who'd like to join these sessions from West Africa and those from Francophone countries are able to access all of this information. The French presentation was circulated in the calendar invite as well, so you will have copies of that. And the English one will be available after the session as well. So it is a little bit of a new process for us, so please be patient and bear with us, as sometimes there may be a delay or a few hiccups, but bear with us as we do like to offer this opportunity in French as well. Okay, next slide. So I see that there have been a number of people introducing themselves in the chat. If you haven't yet, please go ahead and do so. We have folks on the phone from USAID, from CDC, both from headquarters. We have folks joining from USAID in Mali. And we have people joining from Senegal, from Zambia, Burkina Faso, Cote d'Ivoire, Nigeria, Ghana, Senegal. Welcome, everybody. Give a few moments for people to just join in the chat. Okay, next slide, please. So for those of you who are just joining, I see more people are joining now. Please do access the interpretation feature. You'll see at the bottom of this slide, it shows where on the screen is the interpretation feature, that little globe there. If you click on that, you can choose whether you want to listen to the session in either English or French. And then click mute original audio if you are joining in French. That will help ensure you have a very clear translation. Okay, great. So let's dive in. If there's any questions about the translation features or anything at all, please feel free to put it in the chat. And you can access the chat feature at the bottom of your screen as well. Okay, so this, for those of you who are familiar with our webinar series, you'll know that many of the sessions generally fall in one of these areas of the product introduction framework, either in planning and budgeting, supply chain management, delivery platforms, uptake and effective use, or monitoring. And PrEP-related stigma really falls in this area of uptake and effective use. As we know, stigma has a big impact on whether people may choose to access PrEP or continue to stay on PrEP for the duration of time that it's needed. So this is the area of that introduction framework that we will really be talking about. Go ahead, next slide, please. Our agenda for today's session, we'll have an overview of PrEP stigma. There will be some testimonies from PrEP users from around the region. And then we'll have breakout room discussions. The past few sessions, we've been trying to reduce the presentation time of these sessions and increase the amount of time we have together in smaller groups to have more conversation, more experience sharing across the different countries and the different programs that are represented on the call. So we'll have some breakout discussions based on and reflecting the testimonies that were given and just about PrEP stigma in general. And then we will have a report out from the breakout room discussions at the end of the call. Next slide, please. So today's facilitator is Florita Durueke, and she is a public health practitioner and community advocate. She is passionate about getting HIV prevention tools into the hands of people who need them. Currently, she is the executive director of the new HIV Vaccine and Microbicides Advocacy Society in Nigeria. We are very excited to have Florita here with us today. And I will turn things over to you, Florita. Thank you so much.
Thank you so much, Susie. It's a pleasure to be in this great audience to discuss such a pertinent issue around PrEP and stigma. Thank you once again. So moving forward, I'll try to do a little overview of PrEP and stigma, and thereafter I'll call our panelists to share their experience. So basically, stigma, we already know, just to remind us again what PrEP stigma is all about. So stigma is defined as personal attributes or characteristics that are socially dishonored, conferring a negative judgment or value onto the individual. So, and it's also well known that PrEP is an effective tool that can be used to prevent HIV infection and change the global tide around HIV epidemic, if people who need this PrEP can use it. But obviously, PrEP stigma is slowing down the uptake of PrEP services. So Susie, can we have the next slide so that we flow with it? All right. So we have compelling evidence from researches conducted across the globe that shows that PrEP service to individuals who actually need it. The adherence and continual use of PrEP, as well as persistence and PrEP use. Apparently, we share impact, the impact of social stigma on perception of people on their HIV risk, and therefore they will not be able to make informed decisions around risk reduction and possible use of appropriate products. The same applies to PrEP. So basically, social stigma is able to reduce the perception of people to see PrEP as an appropriate HIV prevention tool for them. A study that was conducted in Kenya gave an elaborate expression of the different perception of PrEP among PrEP users. PrEP users has reported that stigma around PrEP can be expressed in terms of product stigma. What does that mean? People who use PrEP are scared to expose the PrEP bottle because their peers, their sexual partner, their family members could see it and link them up to being HIV positive. And so they hide it. And by so doing, they will also find it difficult to take the PrEP at the appropriate time and keep to its adherence. The Kenya research also reported the issue of identity stigma. If you look at our policy document, stigma is defined as a product that is for those that are at very high risk. And for my country, Nigeria, stigma is linked to key population, which include men who have sex with men, female sex workers, people who use drugs. And because of this, people are scared. There is that stigma that, oh, if I have this PrEP on me, I will be tagged among the key population. So there is that identity stigma. There is also the issue of behavioral stigma. HIV is already linked to high-risk sexual behavior, sexual promiscuity, and all that. And of course, PrEP is used as a drug to prevent HIV infection. By so doing, PrEP is linked to an irresponsible behavior. So people who use PrEP have reported in Kenya that they are scared that using PrEP, they will be identified as those who engage in promiscuous behavior. So in terms of PrEP stigma, it's not just limited within the community where the PrEP users reside, but it's also across the program area, the health facilities. So we see PrEP stigma being perpetrated by peers, family members, spouse, and healthcare providers. And this is often expressed in prejudice, discriminatory attitudes, stereotyping, and labeling of PrEP users. Most so in our health programs, in our programming around PrEP, we have a lot of language that is also speaking to the issue of stigma. If I walk up to a PrEP clinic, they want to see if I'm among the high-risk behavior, the high-risk population that should access PrEP. The first question is, am I an MSM? Am I a female sex worker? Am I a person who uses drugs? So this tends to create some form of stigma that scares people to openly go to the facilities and access these services. What about the issue of eligibility criteria? Where the healthcare provider will start asking, how many sexual partners do you have? How many rounds of sex do you engage in? How many condom-less sex do you participate in? All this language narrative around PrEP programming also potentiates some form of stigma. And moving forward, I think we can continue to train and retrain healthcare providers to better understand language use and PrEP services provision for those who need it. We need to continue to raise awareness and change the narrative of tying.
Florita, I think we're losing you a little bit. Your connection has gone out.
PrEP, part of the service delivery. I can walk into a clinic and I can walk into a facility and obtain PrEP, just as I can walk into a facility and obtain malaria services. So finally, we need to change the narrative around the language on PrEP use in our health program. Presenting oral PrEP as a responsible choice in sexual health plan to prevent HIV acquisition will increase the impact of oral PrEP, prevent more cases of HIV acquisition, and also reduce stigma. On that note, I would like to call our panelists so that we can hear directly from them, what is it like using PrEP, either as a current PrEP user or a past PrEP user. Thank you once again. So I want to call on our first panelist, who is Cynthia Bashir. Cynthia Bashir is an advocate from Ghana. Are you there? If you're there, Cynthia, can you unmute Cynthia? Okay, so Cynthia, for this conversation, is she there? Is Cynthia there? Can she just respond? I know that she's there. Okay, great. So Cynthia, for this conversation, you have 3 to 5 minutes to share with us what your experience is like around PrEP use. Specifically, you're going to be discussing your experience with stigma as a past PrEP user or a current PrEP user, and also share with us how this issue of stigma can be addressed. Also, feel free to share with us any form of experience you had with the use of PrEP. You have the floor, 3 to 5 minutes. Thank you.
Ok, bonjour, je m'appelle Cynthia Bachir. Je suis à l'RDC. J'ai 33 ans. Je vais partager avec vous mon expérience sur la stigmatisation à la PrEP, liée à la PrEP. Au début, c'était difficile parce que mes amis se moquaient de moi. Quand je prenais la PrEP, pour eux, ce n'était pas la PrEP, elles croyaient que c'était la RV. Au début, c'était difficile, je me suis dit d'arrêter, mais pour moi, ma conscience m'a interpellée de continuer à prendre la PrEP parce que je suis beaucoup plus exposée. Je reçois plusieurs clients. Au fur et à mesure, j'ai convaincu mes amis à commencer aussi à prendre la PrEP. Je les ai convaincus comment? Je les ai expliqués, je les ai sensibilisés, je les ai dit cette produit nous permet de se protéger à l'avenir parce que nous recevons plusieurs clients qu'on ne sait pas leur état d'âme. C'était ça mon expérience. Et connaissant leur état de santé, on reçoit plusieurs clients, d'autres clients qui ne veulent pas utiliser les préservatifs, en cas même de relations sexuelles, en cas de déchirure de préservatifs. Tout ça, je suis maintenant protégée contre la VIH-Sida en prenant la PrEP.
Thank you, Cynthia. Thank you for that experience sharing with us. So do you have any last word for the team in terms of what is it like for you using PrEP? Do you have any last words before I move to the next speaker? No. Okay, thank you. So quickly, I move to Josephine. Josephine Aseme. Josephine Aseme is also an advocate. I think I know Josephine is an EVAC fellow from Nigeria. So Josephine, you also have the floor to share what the experience is like in terms of PrEP stigma and its use. Okay, so as I said earlier on, you're going to be telling us what experience you had with stigma and PrEP access. Also look at how PrEP stigma can be addressed within the context of community access to PrEP, and also any other experience you had that you want to share with us. Thank you.
Thank you, Madam Florita, for the opportunity. I'll be sharing my experience as a PrEP user and a sex worker, because I'm actually a sex worker in Nigeria. And I'll say that when I got enrolled into PrEP for the first 1 year, it was a lot of challenging. PrEP-related stigma actually kind of affected me to openly assess PrEP at public health facilities that offer PrEP services, especially in cases where there is lack of OSS in these locations. As well know, as a sex worker, I'm quite mobile, so my business as a sex worker kindly move me around. So in places where there's no OSS, I find it very difficult to assess a PrEP. I found myself that my adherence at that point was very, very low. I couldn't adhere because when when my PrEP pill is finished, to refill becomes very difficult. And this is because of the notion, or should I say the stereotype, that PrEP is made for individuals who are promiscuous and individuals who kind of involve in risky behavior. And looking at myself as a sex worker, it's kind of affected me. It got a point, and because at that point also, I was dealing with the issue of self-stigma, which with the stigma I was kind of getting from healthcare workers that are not operating in the OSS, as at that time, it became very, very difficult for me to cope with PrEP. And this is obviously associated with the issue of the criminalization of. And second, because of this misconception, looking at PrEP pill then, I had to even remove the pack, the containers write-up just for me to hide it. But then at that point, I wasn't just having issues with healthcare providers, but I had to deal with other sex workers that operate in the same space with me. I had to deal with my family members because it took a long time for them to understand the fact that PrEP wasn't meant for HIV positive persons, in the sense that I was using it daily and looking at ART drugs that one is expected to take daily, and I was automatically taking my own PrEP daily. It became very, very difficult for me to like cope with that kind of situation because everybody was having that notion that I was living with HIV and the issues were being spread across. And even when at point when the sensitization started coming in our hotspot at that particular time, people get to understand, but how do I get to deal with people that have actually spread this news to? So that automatically affected a lot of relationship I had with people. I had an issue of psychosocial issues then because I was dealing with myself, with the whole community then. Going out became very, very difficult because people get to like point fingers that, okay, she's actually living with HIV, and that really affected my adherence on PrEP.
Okay, so quickly, Josephine, just in 1 or 2 words, what do you say to stakeholders in terms of dealing with this issue of stigma? Thank you.
Yeah, there's a need for us to do an adjustment in PrEP. Let's look for other prevention methods that can actually not be something that becomes daily. There's also a need for us to start changing the PrEP container. Let the container look a little bit different from the ARV's container. And also there's a need to start pushing for advocacies and awareness where people get to sensitize about PrEP, understand what PrEP is all about. And most importantly, just like we have the ART's support group, there's a need for us to start having PrEP support group. This automatically will create opportunity for sex workers to share their experiences and their challenges at the same time, and possibly get solutions that can support the PrEP demand creation within the sex workers community. Thank you.
Thank you so very much. Thank you so very much for such great insights into your experience and what we can do differently. So on that note, I want to invite Bolaji Ibrahim. Bolaji Ibrahim is an advocate, precisely NAVMA's Leni champion, and also an advocate. So we're going to hear from him now in terms of his experience with PrEP use. So Bolaji, just follow the suit, your experience, what you think we can do differently, and then share any other thing you want to hear from us.
Yeah, good afternoon, ma'am. Good afternoon, everyone. Yeah, this is Bolaji. My experience on PrEP was that when I start using my PrEP, I got a stigma from my community member from the start. So I guess because maybe my stature, because I'm a slim person, and most of them thought maybe being a slim person or being not having body or anything, they think the person is HIV positive. So I guess they don't know the difference between PrEP and ARV. So because by then I felt somehow, because I was like, I'm not HIV positive. You guys are just trying to stigmatize me on what I don't mean. So then it got to a stage I have to do my HIV test on my own, and I was trying to post it online for them to know that no, I'm not HIV positive, I'm negative, and I'm on PrEP. So then, and most of people still don't believe, except the one that closer to me. And I don't even know that one of a friend of mine that works in PC, someone asked him that, are you sure Bolaji is not HIV positive? So the person that brought up my care card that, yes, this is on PrEP in this our facility. I guess that's that most of them believe that, yes, I'm not HIV positive, then that, yes, I'm on PrEP. And what I want to say again is just that, yes, this our community, I guess we need to do like a advocacy for them or a support group discussion on PrEP so that they will be able to know and differentiate between the PrEP and ARV in this our community in Nigeria, because most of them believe that everybody is HIV positive, and the stigma keep on so and so on like that. So I think that's all. And the behavior of everything is just that I just want maybe if the founders can enlighten us very well on the stuff, so that we'll be able to know what to do, so that most of our community members will be able to know what they are going through, and they will be able to, if they are HIV negative, they should give them on PrEP, and if they are positive, they should go on ARV.
ARV treatment.
So I think.
Thank you, Bolaji.
You're welcome, ma'am.
But is there any other experience you had with PrEP use that you want to share with us?
Yes, under my PrEP use, the first time it was funny actually, and I was scared in the first place, because under my PrEP use was that I started, because when I got to the facility, they differentiate how I'm going to use, like if I'm okay using it in the night daily. So I chose night that day. Like I started by 10:30 that day. But my first experience was that I started vomiting and I was feeling dizzy. So, and the next day I was scared. I went with a friend also, and my other person could not take it, all because of my own reaction that day. So he was also scared of using it. But I told him that you just don't have to be scared. Just take it and know that. But with time, I got adapted to it.
Thank you. Thank you so much, Bolaji. Such a great insight. All right, so we call upon Funshaw. Is Funshaw on?
Yes,
Funshaw, are you there?
Good afternoon, Loretta.
Okay, great. So Funshaw is a human rights activist and also an advocate from Nigeria. Let's hear him. Follow suit, Funshaw.
Okay, thank you. The use of PrEP is very, very important for the key population, but the stigma around it, which is caused by social norms, religious values, in Nigeria particularly. Nigeria is a very religious country, so if the young person who is typically unmarried is seen using PrEP or PEP, the belief is that, okay, the general belief and general conclusion is that you're having sex. So that alone is going to bring stigma of its own. So you're having sex. This can come from your religious leaders, your parents, your friends at school. Like when I was using PrEP in school. So my colleagues, saw the bottle and they were like, oh, they Googled it, what's PrEP? And all they concluded was it has to do with HIV and it has to do with protecting yourself from HIV, and it's a drug that has to do with HIV. So they just concluded that you're having sex, one, and it has to do with HIV. They didn't know if it was a preventive method or something that treats if you've already contacted the HIV. But their conclusion was you are having sex, and that brings stigma. And this kind of affects adherence. So you don't want them to keep saying you use this bottle. But as a person who is outspoken like myself, I went further to educate these people on the importance of actually protecting yourself, that whether that has nothing to do with your sexuality, your age, or anything, your occupation, that as long as you are an adult or if you are sexually active, it is your responsibility to protect yourself. So there's basically the stigma, but this stigma comes from lack of information. So I believe when people are more educated, the stigma around PrEP use will not be so much, but there's a stigma currently because of lack of information of people.
Thank you. Thank you so very much. Is there any specific experience you had with PrEP use besides the issue of stigma you want to share with us?
Like Bolaji stated, yes, the early days of using it, you likely experience side effects like dizziness, weakness, general weakness. So those are the side effects. I would really appreciate it if the scientific team can look into it to correct this situation, because this also affects adherence. It even affects people requesting for this drug. As Bolaji said, his friends were not willing to get on these treatments because of what they saw him go through. If something can be done to mitigate the side effects, so that'll be very, very important. And if something can also be done to educate not just the key
All
population,
right,
but
thank you
the
so
general
very much. Thanks,
population.
Senilion.
Thank you.
Thank you, Funsho. Thank you. Great insight. So we quickly call on Fifi. Fifi Asamo. Fifi Asamo is from Ghana, also an advocate. Fifi, you have the floor. Hope you are connected.
Hello.
Okay.
Hello.
Fifi, go ahead. Speak up a bit so we can hear you.
Okay. Good day, everyone. This is Fifi. So I'm 23 years old and I'm a PrEP champion at WAF. So I've been a PrEP user for a year now, and I'll say my experience has been okay. And I have a different experience to my peers on this platform now. I haven't had any issue with stigma. This is because I keep a close circle of people I share my experiences with. And I'll admit, this is because of the fear of stigma.
First, we can't hear.
Can you hear me?
I can hear you now.
You can hear me? Hello?
Yes, we can hear you, Fifi. You said that you have had a different experience and it's because of the fear of stigma.
I think Fifi is having some connectivity challenge. Or are you hearing Fifi? Others?
Yeah, I think it's the network. Let me get to
Yes, we can hear Fifi.
Yes.
We can hear him.
Yes. The back. Okay, so I think
Hello?
while we wait for Fifi to fix his
Florita,
network.
we can hear
Are you-
him.
Yeah,
Yeah.
Oh, so
Florita,
that-
yeah, it might be
Yeah?
your side, Florita, because I think the rest of us can hear him okay.
Okay, so let him go ahead. Let him go ahead. So maybe it's from my hand.
Go ahead,
Go ahead,
Fifi.
Fifi.
Fifi, go ahead.
You're on mute if you're trying to speak, Fifi.
Unmute yourself and speak, Fifi. Okay, otherwise we call Kate over, and then later Fifi can come on board again. Can we have Kate? Kate over. Is Kate connected?
Yes, it looks like she's
Hello,
here.
Kate.
Kate, you're on mute. I don't know if you can unmute yourself. Oh, there's Fifi. Go ahead, Fifi.
Okay. Sorry for the network issues. So I was saying, for a year now, and I've not had any issue. I rather have a very close circle that I share my experiences and PrEP use with. And I'll admit, I do this because of the fear of stigma, because I should be able to share my experiences and be bold enough to say, yes, I'm on PrEP, but this is not the case because of the fear of stigma. So in as much as I don't go through stigma as an experience, I do certain things to prevent stigma. So yes, there's the fear of stigma over there. And personally, I don't have a problem reaching out to get PrEP. I don't have a problem with it. My peers may have a problem. My peers will have a problem with it because as a PrEP champion, you advocate for PrEP and tell people, oh, you have to reach out to the clinic to get PrEP, and they'll rather want to meet you outside the clinic in order to get PrEP, which is just not professional. So they are afraid of reaching out to the clinic for the fear of stigmatization. I have been to the clinic and I know how professional the medical services are. But my peers will not be able to go to the clinic just because of the fear of stigmatization. So that is a really huge problem. And I personally can't talk to my family about certain issues like this. So the fear of stigma, yeah, it prevails. And those who are open about it, I believe, yeah, they face a lot of stigmatization. which something has to be done about. And my suggestion is there need to be more education. Queer individuals have to be educated themselves on the issues of PrEP use and sexual health, because the problem is inherent. You need to address the people that are facing these issues themselves. So when you educate them, it will be easier to educate allies.
Activer le son. Il y avait le son, mais le son est parti. Je les vois, on se voit, mais il n'y a pas le son. Il y a le son chez toi? Ou bien c'est une pause? Mais qu'est-ce que...
Hi, everyone.
Okay.
Hey, Katie.
Is everybody back? Yeah.
Hi, we're back.
Welcome back. Okay, it looks like we
All right.
are all here. We did it. We went to rooms, we came back.
Yeah.
All right, I hope everybody had some good discussions in the breakout rooms.
Yeah, we did.
We did.
And Casey, remind me, I think did we have 6 breakout rooms or 5?
We had 3 each for French and English.
Okay, so let's go ahead and get some volunteers of some of that conversation, and we can have a brief report out. I think we have, what do we have? Maybe 10 minutes?
Le groupe 3 en français.
We have
Le
about
groupe 2 en français, c'est bon?
I think we can English, then group 3 English. Just 3 minutes. Do quick.
Hi, sorry, everyone will need to pick their language again.
Oh, yeah.
Thank you, Chris.
Please
yes. Let's go to the interpretation feature at the bottom of the screen and choose either English or French. Thank you for that reminder. Okay, so
Le groupe 2 en français avec Madame Dinderos. Merci.
Sure.
Go ahead.
We
Allô?
have lost him. I think we have
Oui,
lost
vas-y,
him.
Madame Dinderos.
Oui, d'accord. Pour le groupe français, nous avons pris la question 4. Comment ces défis sont-ils surmontés? Et là, le gros défi qu'on a retenu selon, disons, en Côte d'Ivoire, c'est comment amener les couples, tous les couples sérieux discordants à utiliser la PrEP. Et nous avons proposé 2 questions, disons, nous avons proposé c'est mettre en place un pack de suivi et qui serait permanent en mettant l'accent sur l'accompagnement psychologique et aussi faire un plaidoyer au niveau des autorités nationales pour, je pense, au niveau des autorités nationales pour l'utilisation de la PrEP, je pense. Si je ne me suis pas trompée, celui qui a proposé là, si c'est ça, il peut aussi me corriger, merci.
Okay, thank you. So that was the group 2 from the French-speaking group. Who was in the first French-speaking group? Who was the facilitator there? Or do we have a reporter?
From Patrick, I think Patrick's supposed to report for French Group 1.
Hi, thank you. Yeah, this is Patrick. It's actually my colleague Jibril Boré from USA Mali is going to be the reporter. I think he may be reporting in French.
Oui. Ok, merci bien. Donc, dans le groupe 3, groupe français, donc nous avons eu comme réponse dans le groupe à la première question qui consistait à quoi ressemble la stigmatisation liée à la PrEP dans votre pays. Nous avons eu beaucoup d'expériences venant du Mali, du Cameroun, du Burkina Faso et du Sénégal. Donc, par rapport à cela, nous avons trouvé qu'il y avait des entraves à l'accès aux soins avec fermeture des structures de santé pour les populations clés. Il y avait des transformations de l'information, les gens étaient stigmatisés en leur disant qu'ils étaient des infidèles et les gens s'auto-stigmatisaient également. Il y a eu même des situations d'emprisonnement où des gens sont partis en prison juste parce que les gens n'avaient pas de bonnes informations par rapport à la PrEP. À la question 2, donc il se trouve que les personnes sont confondues avec les personnes vivant avec des VIH à cause du produit qui est les ARV également. Donc, par rapport à la troisième question, les défis, c'était vraiment des défis de la communication, parce que l'information correcte à propos de la PrEP n'était pas à tous les niveaux. Et également, les populations clés étaient spécifiquement les cibles qui sont déjà stigmatisées par les populations. Donc, comment surmonter ces défis? C'était quand même de renforcer la communication autour de la PrEP et d'élargir l'accès à plusieurs populations à risque, pas uniquement les populations clés dans le pays. Voilà un peu ce que le groupe 3 français a pu collecter. Donc, je laisse la parole à mes collègues Patrick et Gaston pour me compléter.
Thank you, Jibril. Yeah, no further additions from my end. Gaston, did you have anything to add?
No, I think it was a pretty good summary of what we discussed.
Okay, great. Thank you. Chris Obermeyer, in that first English session.
Il y a un groupe.
Oh, go ahead.
Ok, il y a un groupe français qui n'a pas intervenu là. Merci.
Oh, please, go ahead.
Madame Demederos, est-ce que vous pouvez prendre la parole pour le groupe?
Oui, bien sûr, je suis là.
Oui, allez-y.
D'accord, donc je me cherche pour faire le compte rendu de nos discussions. En rapport avec la première question, la réponse du groupe a été que la stigmatisation est vraiment présente dans nos différents pays, vu que cela est assimilé à la prise d'ARV. Et donc, cela affecte l'utilisation correcte de la PrEP, tout comme la stigmatisation affecte l'utilisation correcte des ARV dans nos différents pays. Concernant la question 2.
Okay, that's okay, Miriam. We'll just let her finish speaking to this.
Vous m'entendez? Allô?
Oui, vas-y, on t'entend, vas-y.
Voilà, donc en rapport avec la question 2, la réponse a été que ces types de stigmatisation font allusion au comportement sexuel, vu que une personne négative, quand elle prend la PrEP, cela signifie pour les gens que la personne a beaucoup de partenaires sexuels. Et donc, la lésion, c'est également pareil pour les personnes VIH, vu qu'on se dit que c'est parce que ces personnes ont plusieurs partenaires sexuels qu'elles ont été infectées par le VIH. Et donc, leur comportement est taxé de mauvais comportement. En rapport avec les défis, c'est principalement un défi concernant la communication. Voilà, donc faire connaître le produit à la population générale et à la population clé. Et comme suggestion, c'est d'utiliser plusieurs moyens de communication, dont les réseaux sociaux, pour faire vraiment connaître l'utilisation de la PrEP, l'importance de la PrEP et pourquoi c'est important de l'utiliser. Donc, réfléchir également à la cible de communication. Il y a eu également le problème de disponibilité, le défi de disponibilité des médicaments de la population à temps dans les différents sites. Voilà, donc il faut que la logistique puisse bien se faire pour qu'elle puisse s'adapter au système de logistique et d'approvisionnement déjà existant. Il y a eu également comme défi la formation des prestataires. Donc, tous les prestataires, sans exception, doivent être formés dans le but d'avoir un langage approprié pour éviter de stigmatiser les personnes qui viendront pour l'utilisation de la PrEP. Alors, comme solution, c'est de définir une stratégie dans nos différents pays, une stratégie qui énumère les méthodes et les différents besoins, également élaborer des outils et des documents de communication et surtout vulgariser ces documents-là à tout le monde afin de faire connaître la PrEP aux populations cibles. Comme solution à ces défis, c'est mettre l'accent sur la formation. Former tous les acteurs sans exception et sans oublier aussi les conseillers communautaires qui sont au cœur des activités et surtout mettre également à la disposition de ces conseillers communautaires-là les outils de communication pour la sensibilisation. Merci à vous. On m'a entendu?
Oui, on t'a
Est-ce qu'on m'a
entendu.
entendu?
Yes.
Merci.
Thank you so much. That was great. And thank you very much, Miriam and Aubrey. Let's see. I think Joseph Galadima is going to report out. Hi.
Yes. Good afternoon. Yes, good afternoon, everyone. My name is Galadima Joseph, and I'll be speaking on behalf of my teammates. So yes, we talked about the first question, or we addressed the first question, which says, what does PrEP-related stigma look like in your country and how does it affect? So we had contributions from Ghana and also from Nigeria too, whereby we addressed it and we talked about the myths and misconception on PrEP use, that when people talk about PrEP use, the myths and conception around it could tells people that, oh, you have an elevated sexual risk behavior. That means you have numerous sexual partners. That's why you're using PrEP. There's also the misidentification of PrEP containers with ARV, which could cause us drug stigma, and the assumed perception that PrEP users are HIV positive. That some people feel like there's nothing called PrEP, and PrEP is just to help HIV positive people. We also talked about the PrEP disclosure and the perceived reception that they get, especially when they disclose PrEP. And we talked about, we also talked about the PrEP use amongst discordant relationship, or among people in discordant couples is very low, and that's because most of them, or some of them who are positive are yet to disclose their HIV status with their partners. So that's on their own. When they discuss PrEP use to their partners, or when they discuss it or recommend it to their partners, it could pose as possible conflicts, especially in their relationship. Yes, we also talked about the fourth question, which is how are these challenges being overcome, and how could they be overcome? What are the next steps? So we said that we will have to intensify our awareness and re-educate PrEP use among service providers at the facility, at the OSS. We need to also re-educate them on what PrEP is all about, the PrEP use, and also the eligibility criteria on PrEP use, because we also have to look at the KPs, people in discordant relationship, and also sexually active adolescents too. We also talked about creating an enabling environment for service provision to KPs, most especially to the fact that most of them are being marginalized, and also the policies that have been enacted in Nigeria, in Ghana, especially among the MSM community, gay people, is not conducive enough for them to want to come out. And so so in another way of addressing it, we have looked at the community refills and also same-day PrEP initiation, using or putting into cognizance that we also have to screen them using the urinalysis test script to know if there's proteinuria, if there's enough protein in their urine, and if there is, we know that yes, it can pose as a challenge in initiating them on PrEP. We also talked about intensifying PrEP use among discordant relationship. That's in intensifying it. We also have to recommend the safe and ethical index testing services to them, and also sexually active adolescents. So we also need to intensify it. And we also talked about intensifying HIV self-testing too, and that also can help us in overcoming some of these challenges. And when we intensify HIV self-testing, we also have to follow them up to know the status, and also do the community PrEP initiation. And on that note, I would like to say thank you very much, and over to you.
Thank you, Joseph.
Thank you.
Melanie, in your group, the second English one, do you have a facilitator or a reporter, excuse me?
Yeah, Venna is going to be reporting out for us. Go ahead, Venna.
Okay, thank you, Melanie. Okay, so for us, we were given the question 1, what does PrEP-related stigma look like in your country, and how does it affect HIV prevention methods? Okay, so the inputs that came on the floor were this regarding what does PrEP-related stigma look like. For our group, some members thought that the language narrative surrounding PrEP being for KP populations, or PrEP being KP focused, is promoting stigma in some countries. Yes, so already these KP groups are considered social minorities in countries. And so hearing that PrEP is for them, there is the fear that if they go to their facilities, they will either be stigmatized or labeled as a KP. And so they will not go. And this can help hinder HIV prevention efforts. So that was one. There was also an input that the attitude of some healthcare workers, some healthcare workers is promoting stigma. So relating to the sharing of experience by one of the speakers, that when she went to the health facilities, instead of getting a service, and she was judged that she should change her profession, it's something that should be looked at. So that was also a problem. So looking at what we can do to prevent these issues, or these stigma-related PrEP, there was a suggestion that we look at sensitizing the healthcare workers and providing continuous capacity building for them. So we had one speaker who shared her experience where in her country, they've had a meeting with some of these healthcare workers to address how we can prevent stigma at the health facilities. And there was a suggestion that we change the language or the awareness that PrEP is an antiretroviral medicine to PrEP being a medicine for HIV negative people, so that people do not confuse PrEP being linked to ARVs, because for her, some people are of the view that when they take PrEP, they are likened to being HIV positive persons. And so that is promoting stigma. So because the medication is an antiretroviral drug, and not all people will understand the differences as regarding prevention, and then minimizing to achieve viral control. So viral load control. And so we thought that there was a need to continue building the capacity of healthcare workers on how they provide service professionally, their do's and don'ts that can help rather promote PrEP and rather prevent stigma. There was also a suggestion that we should intensify education using our traditional leaders. And then when we educate them, we also use them in advocacy. So our traditional authorities have a role to play in our traditional settings. And so first, sensitizing them and using them to propagate the role of PrEP is key. But then we should also look at who PrEP is for. So we should be focused on propagating PrEP use among the general population and not necessarily focus on key populations, because you would, in some instances, you would have some adolescent girls who feel that they are at risk of HIV, who may want PrEP, but then would turn away knowing that it's for key populations. So they do not want to be labeled as prostitutes. And so there is a need to look at advocating PrEP for the general population, using our traditional authorities, our healthcare workers, our policy interventions for the general population, so that it's not limited to key populations. Also, it's important that we document. One speaker said that as part of the service provision for PrEP, at any point in time, if any PrEP client wishes to discontinue, they are supposed to come to the facility, the PrEP giving facility, and then give their reasons and be counseled before they discontinue. But in some cases, they do not come, and some of these reasons might be stigma related. And so there's a need to encourage that our KP clients or our general population clients or clients on PrEP in general who want to discontinue PrEP to speak to their service providers, because some of these might be stigma related, but because they do not come, they are not being able to counsel on how they can still use PrEP and then feel safe using the drug. So this is what I gathered for my group. Group members can add on if I missed anything. Thank you. Over.
Thank you so much. We are at the end of the call, so we do need to quickly wrap up. I was the reporter for the final group that hasn't shared yet, and we talked about many of the same things, really highlighting that many of the shared testimonies reflected similar stigma as that of HIV treatment experiences, hiding ART, difficulty finding someone to confide in, and talked about that quite a bit. And some of the ways to address this that were discussed was creating separate clinic days for PrEP clients, expanding PrEP delivery outside of the ART clinic, expanding into outpatient services, offering PrEP at the point of counseling for HTS services and other mechanisms. But the need for wide general population awareness building and education about PrEP was definitely highlighted, as you all have mentioned. In terms of the upcoming sessions, we do have September 30th will be HIV resistance and laboratory monitoring, highlights from GEMS, a resistance project, HIV resistance project, as well as an update from WHO on their latest guidance regarding creatinine clearance, particularly in their latest updated PrEP guidelines. So thank you all very much. There's a link to sign up to receive updates and invitations directly on that previous slide. I really wanted to say thank you to Audrey and Miriam, our translators today, to Florita for facilitating, and everyone who provided a testimony. Thank you so much for sharing your experiences. The call recording will be available on the West Africa Learning Network page on Prep Watch. And that link is below on this slide. And to join the mailing list, we'll have all of these resources posted on the Prep Watch page as well, and Casey has put them in the chat. So thank you so much for joining, everyone, and we look forward to talking later in September. Thanks. Have a great rest of your day.